Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomy of the prostate gland. The prostate is the largest accessory male sex gland. It adds bulk to the seminal fluid. It is a fibromuscular gland. It contains smooth muscle along with the tubuloacinar glands. This is the prostate gland. It is located below the neck of the bladder, above the urogenital diaphragm, behind and below the symphysis pubis. It is just anterior and above the anal canal and anterior to the rectum. And it contains the prostatic part of the urethra. Okay. If you look at the posterior part of the urinary bladder, then you will find out some structure like this is the urinary bladder composed of detrusor muscle, and inside we have the transition epithelium. Outside on the superior surface we have the peritoneum here. We'll give emphasis here the formation of ejaculatory duct by the union of the ductus deferens and the seminal vesicle. So we have the urinary bladder, the ureter, that is crossed by the ductus deferens, the seminal vesicle, and the formation of ejaculatory duct. And this is the prostate, apex of the prostate, posterior lobe of the prostate, and this is the base of the prostate. Okay, if you look at the hemisection of the pelvis and perineum in male, we'll find out this is the urinary bladder, and then this is the neck of the bladder, and the prostate is below the neck of the bladder. Prostate is above the urogenital diaphragm here. This is the external urethral sphincter here, and also the perineal muscle, the transversus perineal muscle. And we have the neck of the bladder. Here is the location of the internal urethral sphincter, and this is the prostatic part of the urethra receiving the ejaculatory duct that is formed by the union of the ductus deferens and the seminal vesicle. So we got the apex here, base here, anterior surface with the posterior surface, and we have two infralateral surface. So lobes are anterior lobe, posterior lobe, median lobe, two lateral lobe. Median lobe is described as the area of the prostate gland between the opening of the ejaculatory duct and the prostatic part of the urethra. We have two type of capsule: true capsule that is continuous with that of the stroma, false capsule derived from pelvic fascia. Okay, so the prostatic venous plexus is embedded on the false capsule, not on the true capsule. And we have fascia of Denon-Wheeler that is present between the posterior part of the bladder and the rectum. We have the puboprostatic gland connects the prostate to the pubic body. So if we look at this image here, this is the coronal section. We have the two lobe of the prostate here. Okay, we should have total 5 lobes, and this is the seminal colliculus. We have two opening of the ejaculatory duct, and we should have one prostatic utricle. Okay, this is the neck of the bladder. This is the urogenital diaphragm. Okay, and this part we have the external urethral sphincter that is voluntary skeletal muscle. This is the internal this is the external urethral sphincter. This is the internal urethral sphincter that is involuntary, that is supplied by the autonomic nerve. So we have the internal urethral sphincter, we have the external urethral sphincter. Here to here is the prostatic urethra. This part is called the median lobe. This is the ejaculatory duct. This is the prostatic urethra. This is the median lobe. This is the anterior lobe, posterior lobe. Okay, we have the lateral lobes here. One left lobe, right lobe. So we should have 5 lobes: left lobe, right lobe, anterior lobe, posterior lobe, and the median lobe. Okay, if you look at the glands, we have arrangement of gland in this way. We have the periurethral gland, we have the transitional or intermediate gland, we have the peripheral glands. The peripheral glands are involved in the cancer of the prostate or adenocarcinoma of the prostate. The periurethral and the transitional gland, peripheral gland are also called the mucous gland. Transitional gland are also called the submucosal gland. Peripheral gland are called the main glands. So the periurethral gland and the transitional gland are mostly involved in case of benign hyperplasia of the prostate. In the initial part of the prostatic cancer, it is usually located at the periphery. Then it will go to that place. Okay, this is the prostatic part of urethra from here to here. This is the internal urethral sphincter that is composed of smooth muscle, and it is innervated by the autonomic nervous system, sympathetic, parasympathetic. Okay, this is the external urethral sphincter that is voluntary, composed of skeletal muscle. It is voluntary. This is involuntary, and this is smooth muscle. This is skeletal muscle. So if you look at this structure, here is the urethral crest, mucosal elevation. This further elevated here, we call it seminal colliculus. We'll get a blind pocket called prostatic utricle that is homologous to that of the uterus in the female. This is the opening, one opening of the ejaculatory duct. This is another opening of ejaculatory duct. We know that ejaculatory duct are formed by the union of the vas deferens and the seminal vesicle. These are the tubulo-acinar glands. They open into the prostatic sinuses here. We have multiple openings. These are the openings. So we got prostatic urethra from here to here. We got prostatic utricle that is homologous to that of the uterus in female. We got opening of ejaculatory duct. Another one is here. So we should say ducts. We have multiple glands that open into the prostatic sinuses. The upper part here, mucosal fold, we call it urethral crest. These are the prostatic sinus. The side of the crest, we have the sinuses for the opening of the gland of the prostate. We have this stroma also contains smooth muscle. These are the tubulo-acinar glands. And also this part, upper part of the posterior part of the urethra is lined by the transitional epithelium up to the opening of the ejaculatory duct. Okay, blood supply and lymphatic drainage. Blood supply from the branches of the internal iliac artery via the inferior vesical artery, middle rectal artery, internal pudendal artery. Venous drainage by means of prostatic venous plexus that is embedded on the false capsule, not on the true capsule, not inside the true capsule. It is outside the true capsule. We have the venous plexus of vein. We have valveless communication to the vertebral venous plexus. So cancer from the prostate gland may go to the vertebral body by means of valveless venous communication. We have lymphatic drainage mostly to the internal iliac lymph node, partly to the external iliac lymph nodes. Okay, so if we go there, nerve supply of the prostate, we have the inferior hypoplastic plexus, sympathetic L1, L2. Okay, L1, L2 from the lateral, intermediate, lateral gray horn of the spinal cord. Parasympathetic from the S2, S3, S4 segment of the spinal cord. Both sympathetic, parasympathetic stimulate the secretion from the prostate. So what are the secretion of the prostate? Prostate secretes the prostaglandin, fibrinolysin. It also secretes the ascorbic acid. It also secretes the prostatic specific antigen. Prostatic specific antigen may also be dispersed to the blood, so we can assess the prostatic specific antigen to diagnose either prostatic, any type of pathology in the prostate like prostatitis, benign hyperplasia of the prostate, or the prostatic cancer. Okay, so benign hyperplasia of the prostate, usually patient above the age of 55. Patient has polyuria and dribbling of urine. Sometimes it may be retention of urine because the periurethral glands and the muscles are hypertrophied that may block the prostatic urethra. Prostatitis is a condition, we call it inflammation of the prostate, may be due to gonorrheal infection. Prostatic carcinoma is a very common male cancer, and that cancer may spread to other part of the body, especially to the vertebral column venous channel. It may deposited by means of the valveless venous channel from the prostate to the vertebral body venous plexus. The cancer cell may go to the vertebral body, especially the lumbar vertebra or lower thoracic vertebra. Okay, so these are my references, and that's all about the anatomy of the prostate. I have also another YouTube video on histology of the prostate. I request you to go through the histology of the prostate that I also has posted, and please share the information with your friend. If you have any question, please feel free to ask me, and please support my channel. Please subscribe me. Have a nice day. Bye now.